Welcome back, our fans. Parts of the brain: 1. Cerebrum, 2. Cerebral hemisphere, 2. Brain stem, A. Midbrain, B. Pons, C. Medulla oblongata, 3. Cerebellum. What is the meaning of ganglion? In central nervous system is solid mass of neural cell bodies that serves as relay center for impulses, usually located outside of CNS. Ganglion located inside CNS called nucleus. It composed of stomata and dendritic structure, which are connected together. Trigeminal nerve. Trigeminal nerve is the largest and fifth cranial nerve. It is mixed nerve involved in sensation of pain, temperature, and light touch of entire face, scalp, nose, mouth. It innervates muscles of mastication. It is composed of 1. Small motor root, 2. Larger sensory root. Motor root. The motor root of the trigeminal nerve arises separately from the sensory root, originating in the motor nucleus within the pons and medulla oblongata. It passes below Gasserian ganglion and joins the mandibular branch of the trigeminal nerve in the foramen oval. Motor fibers of trigeminal nerve supply the following muscles: 1. Masticatory muscles, 2. Mylohyoid, 3. Anterior belly of digastric, 4. Tensor tympani, 5. Tensor veli palatini. Sensory root. Sensory root fibers of trigeminal nerve comprise the central processes of ganglion cells located in the trigeminal, Gasserian or semilunar, ganglion found in the middle cranial fossa. I. Ophthalmic nerve. It is the first branch of the trigeminal nerve. It is purely sensory and is the smallest of the three divisions. Course. It leaves the cranium and enters the orbit through the superior orbital fissure. It supplies eyeball, conjunctiva, lacrimal gland, parts of mucous membrane of the nose and paranasal, sinuses, skin of forehead, eyelids, and the nose. Branches of ophthalmic nerve. 1. Nasociliary nerve. It giving off branches to the nasal cavity and ending in the skin at the root of the nose. It then branches into anterior ethmoidal nerves, external nasal nerves, internal nasal nerves, from anterior ethmoidal, which supplies the mucous membrane of anterior part of nasal septum and lateral wall of the nasal cavity. Ciliary ganglion. Contains sensory fibers that travel to the eyeball via short ciliary nerves. 2 or 3 long ciliary nerves supply iris and cornea. 1. Infratrochlear nerve supplies skin of lacrimal sac and lacrimal caruncle. 2. Posterior ethmoidal nerve supplies ethmoidal and sphenoidal sinuses. 3. External nasal nerve supplies skin over apex and ala of the nose. 2. Frontal nerve. It is the largest branch. It travels anteriorly in the orbit, dividing into 2 branches. Supratrochlear nerves. Supplies conjunctiva and skin of medial aspect of upper eyelid and skin over the lower and medial aspects of the forehead. Supraorbital nerves. Is sensory to upper eyelid, the scalp as far back as the parietal bone, and the lambdoidal suture. 3. Lacrimal nerve. Is the smallest branch of the ophthalmic division. It supplies the lateral part of upper eyelid, a small adjacent area of skin, and lacrimal gland. 2. Maxillary nerve. Origin. It arises from the middle of the trigeminal ganglion. It is intermediate in size between the ophthalmic and mandibular divisions. Type. It is purely sensory nerve. Course. The maxillary nerve passes horizontally forward, leaving the cranium through the foramen rotundum. The foramen rotundum is located in the greater wing of sphenoid bone. Once outside the cranium, the maxillary nerve crosses the uppermost part of the pterygopalatine fossa, between the pterygoid plates of sphenoid bone and palatine bone. As it crosses the pterygopalatine fossa, it gives off branches to sphenopalatine ganglion, the posterior superior alveolar nerve, and the zygomatic branches. It then angles laterally in a groove on the posterior surface of the maxilla, entering the orbit through the inferior orbital fissure. Within the orbit it occupies the infraorbital groove and becomes infraorbital nerve, which courses anteriorly into the infraorbital canal. Termination. The maxillary division emerges on the anterior surface of the face through the infraorbital foramen, where it divides into its terminal branches. A lateral nasal, supplying the skin of the face, nose. B. Inferior palpebral, supplies lower eyelid. C. Superior labial, supplies upper lip. Branches of maxillary nerve. Branch within the cranium. Branches in the pterygopalatine fossa. Branches in infraorbital canal. Branches on the face. Branch within the cranium. Middle meningeal nerve, which travels with the middle meningeal artery to provide sensory innervations to the dura mater. Branches in the pterygopalatine fossa. 1. Zygomatic nerves. It comes off the maxillary division in the pterygopalatine fossa and travels anteriorly, entering the orbit through the inferior orbital fissure, where it divides into zygomaticofacial nerve, supplying the skin on the prominence of the cheek. Zygomaticotemporal, supplying sensory innervations to the skin on the side of the forehead. Just before leaving the orbit, the zygomatic nerve sends a branch that communicates with the lacrimal nerve of the ophthalmic division. This branch carries sensory fibers from sphenopalatine ganglion to lacrimal gland. 2. Pterygopalatine nerves are two short trunks that unite in the pterygopalatine ganglion and then redistributed into several branches. A. Orbital branches supply the periosteum of the orbit. B. Nasal branches supply mucous membranes of the superior and middle conchae, lining of posterior ethmoidal sinuses and posterior portion of nasal septum. One branch is significant in dentistry is nasopalatin nerve, which passes across the roof of nasal cavity and it supplies the anterior part of nasal septum and the floor of the nose. It then enters the incisive canal through which it passes into the oral cavity via incisive foramen. Right and left nasopalatin nerves emerge together through this foramen and provide sensation to palatal mucosa in the region of premaxilla. C. Palatine branches. Greater, anterior, palatine nerve, emerging on the hard palate through the greater palatine foramen. It supplying the soft tissues and bone of the hard palate as far anterior as the first premolar, where it communicate with terminal fibers of nasopalatin nerve. It also provides sensory innervation to some parts of soft palate. Lesser, middle and posterior, palatine nerve. Middle palatine nerve emerges from the lesser palatine foramen along with posterior palatine nerve. Middle palatine nerve provides sensory innervations to the mucous membrane of the soft palate. The tonsillar region is innervated, in part by the posterior palatine nerve. D. Pharyngeal branch is a small nerve that leaves the posterior part of the pterygopalatine ganglion, passes through the pharyngeal canal, and is distributed to the mucous membrane of the nasal part of the pharynx, posterior to the auditory tube. 3. Posterior superior alveolar nerve PSA. Course. It descends from the main trunk of the maxillary division in the pterygopalatine fossa just before the maxillary division enters the infraorbital canal. It passing downward through the pterygopalatine fossa. When two trunks are present, one remains external to the bone, continuing downward on the posterior surface of maxilla 2. Provide sensory innervations to the buccal gingiva in the maxillary molar region and adjacent facial mucosal surfaces. The other branch enters into the maxilla through PSA canal to travel down the posterior wall of the maxillary sinus and provide sensory innervations to mucous membrane of the sinus. Continuing downward, this second branch of PSA nerve provides sensory innervations to alveoli, periodontal ligaments, pulpal tissues of the maxillary third, second, and first molars, with the exception, in 28% of patients, of mesiobuccal root of first molar. Thanks for watching. Support us by likes and subscribes.